Here is a detailed explanation of the functions of the organs of the digestive tract, from the mouth to the anus. 1. Mouth, oral cavity. Functions: ingestion, entry point for food. Mechanical digestion: teeth grind and chew food. Mastication, increasing surface area. Chemical digestion: salivary glands secrete saliva containing amylase, which begins starch breakdown. Formation of bolus: the tongue helps in mixing food with saliva and forming a bolus for swallowing. Taste sensation: taste buds on the tongue detect flavors, stimulating appetite. 2. Pharynx. Functions: passageway, connects the mouth to the esophagus. Swallowing, deglutition. The larynx and laryngopharynx help propel food into the esophagus, while the epiglottis prevents food from entering the trachea. 3. Esophageal functions: transport, moves the bolus from the pharynx to the stomach via peristalsis, rhythmic contractions of muscles. Lower esophageal sphincter, LES, prevents the backflow reflux of gastric contents into the esophagus. 4. Stomach. Functions: storage, temporarily stores ingested food. Mechanical digestion, churning action mixes food with gastric secretions to form chyme. Chemical digestion: hydrochloric acid creates acidic pH, denatures proteins, activates pepsinogen to pepsin. Pepsin begins protein digestion. Intrinsic factor secretion, necessary for vitamin B12 absorption in the small intestine. Defense: acid kills most ingested pathogens. 5. Small intestine. Divisions: duodenum, jejunum, ileum. Functions: A. Duodenum receives chyme from the stomach, receives bile from liver, gallbladder, and pancreatic enzymes for further digestion. Neutralizes acidic chyme using bicarbonate from the pancreas. Jejunum, major site for absorption of nutrients, carbohydrates, proteins, lipids, vitamins, and minerals. C. Ileum, continues absorption, especially of vitamin B12 and bile salts. Overall, the small intestine completes digestion of all food groups. Absorbs nutrients into the bloodstream and lymph. 6. Large intestine: parts: cecum, ascending colon, transverse colon, descending colon, sigmoid colon. Functions: absorption, water, electrolytes, e.g. sodium chloride, and some vitamins, e.g. vitamin K, B7. Fermentation: bacterial flora ferment undigested carbohydrates and produce gases and vitamins. Fecal formation compacts indigestible residues into feces. Storage: stores feces until defecation. 7. Rectum and anal canal. Functions: rectum stores feces temporarily. Anal canal controls defecation through internal, involuntary, and external, voluntary, anal sphincters. Defecation expels feces through the anus. Organ. Key functions: mouth, ingestion, mastication, taste, initial digestion. Pharynx, swallowing, air food passage separation. Esophagus, food transport via peristalsis. Stomach, storage, churning, protein digestion, acid defense. Small intestine, final digestion, nutrient absorption. Large intestine, water absorption, vitamin production, feces formation. Rectum and anus, fecal storage and expulsion. Here are 10 applications and implications of understanding the digestive tract in nursing practice, especially for patient care, health education, and clinical decision-making. 1. Assessment of gastrointestinal function. Application: nurses routinely assess bowel sounds, abdominal shape, and GI symptoms, e.g. nausea, vomiting, diarrhea, constipation. Implication: abnormal findings can indicate serious conditions like bowel obstruction, peritonitis, or gastrointestinal bleeding. 2. Monitoring nutrition and hydration. Application: knowledge of digestion helps nurses assess dietary intake and fluid balance. Implication: malnutrition or dehydration can occur in patients with impaired digestion, e.g. in Crohn's disease, short bowel syndrome. 3. Medication administration. Application: many medications affect or are affected by the digestive tract, e.g. antacids, laxatives, proton pump inhibitors. Implication: nurses must understand GI physiology to give meds correctly, e.g. before meals, on empty stomach, and monitor side effects like GI bleeding or ulcers. 4. Care of patients with feeding tubes. Application: nurses manage enteral feeding, e.g. via nasogastric gastrostomy tubes. Implication: understanding digestion ensures correct formula, rate, and position to prevent complications such as aspiration or dumping syndrome. 5. Postoperative GI care. Application: after abdominal surgeries, nurses monitor for return of bowel function. Implication: delayed peristalsis may lead to paralytic ileus, which requires timely intervention. 6. Wound and ostomy care. Application: nurses care for stomas, e.g. colostomy, ileostomy. Implication: proper management prevents infections, skin breakdown, and supports patient self-care and adaptation. 7. Health education and promotion. Application: nurses teach patients about healthy eating, hydration, and fiber intake. Implication: promotes gastrointestinal health and prevents disorders like constipation and colorectal cancer. 8. Infection control. Application: nurses must recognize and prevent spread of GI infections, e.g. Clostridium difficile, norovirus. Implication: proper hand hygiene, isolation precautions, and education are critical in preventing outbreaks. 9. Pain and symptom management. Application: nurses manage abdominal pain, nausea, bloating, and reflux. Accurate assessment and timely intervention improve patient comfort and outcomes. 10. Support for patients with chronic GI disorders. Application: nurses provide care for patients with conditions like IBD, GERD, or celiac disease. Implication: understanding pathophysiology and digestion helps in managing symptoms, diet modification, and psychosocial support.